My name is Robin Weber, and I am the clinic director at Embark in Walnut Creek. So PHP is a partial hospitalization program. It's what we would call a higher level of care, sort of between outpatient care and residential or inpatient care. So it's kind of moderate care. Our clients in our PHP are here 5 days a week for about 5.5 hours. And for us, the PHP that we have is for teens, teen adolescents, so ages 12 to 18 would be in our PHP program. So people who need more structure, people who need a little bit more care, a little bit more intensive therapy, they're in their home environment still, right? So they're not somewhere else. So they can be with their families, they can be doing some work with their families. We are very family focused, so it's really important that then they can take what they learn here home and generalize to their environment. A lot of our skill building is, working within those frameworks. So that's dialectical behavioral therapy as well as cognitive behavioral therapies. We also do some experiential things, again, like music or, maybe movement, going outside, getting out in the community, getting fresh air, we find is really beneficial. But we're really treating the whole family. So it's not just this identified patient. Right. We really are treating and looking at the family unit as a whole. And I think it's one of the things that makes it unique here as well. So family systems approach is really important. From the beginning, we need to understand what are their goals, right? And make them something that we can measure. And then over time, we're always assessing how are they doing with their goals. Part of it's what they're telling us, part of it's what we see. Sometimes it's what the parents tell us and also by the assessments that they take. Then obviously it's easier to determine by the end, have they met those goals? And what do they still need to work on once they leave us, right? We see people's anxiety decrease. For some people, they no longer have panic attacks. A significant goal is to decrease self-harm for some of our clients, right? And so improving engagement in the family is also a pretty significant goal. By the time they come in on day one, we really want to understand, do you have an outpatient therapist? Do you have an outpatient psychiatrist? Who have you been working with? So that we know from the beginning, that's where we're going to continue to sort of work towards you returning to them, right? Sometimes, clients might check in with their therapist while they're with us. They might do some brief check-ins with them so they continue that relationship. But again, it's really important from day one, if they don't have a therapist or an outpatient psychiatrist, some of the work we're going to do with them is actually helping them before they even get close to discharge, finding those folks for them, because we want to make sure that they have that support in place. We are intense therapy, but we're not long-term in the sense of we're not here for years, right? And so we know that it's going to go relatively quickly, and so we want to make sure from the beginning we're actually identifying what are those needs as we go along. Maybe there's more needs, and then setting them up for success, making sure they have that outpatient care.